Chapter 21 Gynecology A female reproductive system. Womb, fallopian tube or salpinx, ovary, neck of womb or cervix, and vagina. B. Menstruation. A period is the common name for a menstrual monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's note LMP. 2 for 52 ago means the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually reading in the form 4 28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term happy periods means excessive blood loss, menorrhagia, often with a passage of clots, coagulated blood. The term periods pain means dysmenorrhea of painful menstruation. The time when a woman stops menstruating, normally at about the age of 50, is called the menopause or climacteric. In everyday English, it is known as the change of life or simply the chance. Symptoms of the menopause include hot flushes, sudden sensation of heat, and night sweats. A gynecological consultation. A gynecology is talking to a 13-year-old woman. Gynecologist patient. Are your periods regular? Yes. How often do you get them? Everyday weeks. How old were you when you started to get them? About 12. When was your last period? A week ago. How long do the periods last? Usually 4 or 5 days. Would you say they are light or heavy? Light. Do you get clots? No. Do you get period pains? Not normally. Is there any discharge between the periods? A little. What color is it? White. D. Contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, known as the pill, the diaphragm, and the intrauterine device, IUD, or copper coil. Condoms are available for both men and women. Chapter 21. Gynecology. A female reproductive system. Womb, ovary, neck of womb or cervix, vagina, and fallopian tube or cervix. B. Menstruation. A period is the common name for a menstrual monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's notes LMP 2 for 52 ago means the last menstruation period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually writing of the form 4 for 28, which means lasting 4 days and occurring every 28 days if a period lasts more than 4. Ustedes no saben que yo estoy grabando. Que por algo le dije yo que cerrara la puerta esa. Diablo. Chapter 21. Gynecology. A. The female reproductive system. Womb, ovary, neck of womb, cervix, vagina, fallopian tube, cervix. B. Menstruation. A period is the common name for a menstrual monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's notes LMP 2 for 20 for 52 ago means the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually writing in the form 4 for 28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss, menorrhagia, often with the passage of clots, coagulated blood. The term period pains means dysmenorrhea or painful menstruation. The time when a woman stops menstruating, normally at about the age of 50, is called the menopause, or climacteric. In everyday English, it is known as the change of life or simply the change. Symptoms of the menopause include hot flushes, sudden sensation of heat, and night sweats. C. A gynecological consultation. A gynecologist is talking to a 30-year-old woman. Gynecologist, patient. Are your periods regular? Yes. How often do you get them? Every 4 weeks. How old were you when you start to get them? About 12. When was your last period? A week ago. How long do the periods last usually? 4 or 5 days. Would you say they are light or heavy? Light. Do you get clots? No. Do you get period pains? Not rarely. Not really. Do you get period pains? Sorry. Is there any discharge between the periods? A little. What color is it? White. D. Contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, known as the pill, the diaphragm, and the intrauterine device, IUD, or copper coil. Condoms are available for both men and women.